Okay, awesome. All right, I'm Ryan, one of the co-founders at Notero. Nick's joining me as well, one of the co-founders. And yeah, today we're talking about Scribe AI. We've previously done a webinar on this, but a lot has changed and improved on Scribe AI, so we thought it was worth doing another one and show you some of the new ways that you can use it. Yeah, this is, like mentioned, it's recorded, so you can watch this again after on YouTube or share it with anybody that might have missed it. But yeah, we'll dive right in, and yeah, thanks again for everyone for joining. All right, so I'll go over again what Notero Scribe is, why it matters, how it works, how to use it. Then Nick's going to take us through a full demo of using it, and then we'll end off with some Q&A. So yeah, we at Notero, we build features and functionality that is practitioner first. So it's focused on making sure that you can, focus on getting your work done and stay in your workflows. And we believe that like AI workflows, like scribing, should be built right into the workflows of your clinic rather than being separate software. So that's part of the reason why we built Scribe to improve that. Next slide here. So yeah, so Scribe is a AI powered voice to note tool that's built right into Notero. So you don't need to go to another software to do it. You can do it right in the calendar actually of Notero, and it'll send the scribes right to your clinical notes. So you can kind of stay in the workflow of most people's home base of the calendar. So you don't have to leave the calendar to do your scribing. Works on any device, so tablet, phone, iOS, Android, computer, laptop, as long as there's a microphone. And yeah, and the way it works is basically you record your scribe, that gets sent to the Notero Scribe AI, which creates a preliminary clinical note for you. At the end of the idea is that at the end of the day, you review all your scribes and potentially make some adjustments, and then push those scribe values, the actual clinical note, into your clinical note. Yeah, so the Notero Scribe is an AI model that's trained specifically on health and wellness concepts. So that includes procedures, medications, conditions, and so it is, it's very well aware of what typically happens in a clinical setting. Security is top priority, so the recordings and everything are always encrypted, whether it's in transit or at rest. And then when the recordings are done being processed by Scribe, those recordings are automatically deleted. And we never train our AI models from your recordings or the outputs that are created from the recordings. And Scribe is optional to use. So you can use it if you'd like. You don't have to use it if you don't want to, or you can just use it, on some notes and not others. So the way that you use it, basically you can use it for two main use cases, either dictation. So that is the example of describing what happened in the appointment in natural language. And then Scribe will understand the health and wellness concepts and create a preliminary note. Or you can use it to record conversations with patients. So think potentially intake forms or mental health types of encounters, and basically it will identify the participants in the recording, what their role is, so who is the patient, who is the practitioner. It will filter out the small talk, it will filter out the ums and ahs, and it will create a preliminary clinical note based on that encounter. You can initiate the Scribe from a clinical note, of course, but also and what we're seeing most people do is initiate it from the calendar. So the calendar is your home base. You can open up the appointment. You can scribe right from the appointment on the calendar, whether it be on a computer or a phone, for example. Drop your recording in, and then move on with your day. And then at the end of the day, come back and review the scribes. And yeah, that's it for me. Now Nick is going to do a demo for us. So I will stop sharing. And again, if anybody has any questions, feel free to drop those in the chat. Just make sure that you're messaging to everyone so we can all see the answers.
Just to confirm, Ryan, you can see my screen?
Yep.
Okay, perfect. So let me just move this over just slightly. So what Ryan was saying is, I mean, he was just giving some preliminary background of what this feature is. It actually is a really helpful feature. I was in a bit about my background. I was a therapist for over 20 years, an athletic therapist and a massage therapist. And I also worked as an assessor for motor vehicle accident, and seen a lot of notes, and a lot of notes were most notes are done poorly. Doesn't matter what profession you're talking about, whether it was from the medical profession or whether physio, chiro, massage, athletic therapist, so on. A lot of the notes were very poorly documented, and part of the problem is that if you're doing the same sort of treatment, or you just don't have time to document, and you might leave it till the end of the day, or sometimes even till the end of the week, or not at all. It just becomes very hard. It's a very manual oriented task, and so what we're trying to do is we're trying to eliminate that in using these tools. So I know if I was still in practice, this is something I would definitely gravitate to. You don't have to use it for all your notes. I mean, once you have a really good note, you can still use the duplicate function. And I'm going to start. I'll just expose if I just scroll down here. These are pending scribes. We're going to come back to this in a sec. But these are all my scribes that I started doing today from the calendar. I'll show you how this works. I'll show you how you can do it from the calendar or from a note. And we'll just go right to my calendar page. And let me just load up my one calendar here. I'll just go to week view. So, oops, I'll just load myself up here. And so here's a typical day. So I have back-to-back appointments. And so for these 3 appointments, so if I click on any of them, you can see I've added a scribe. And so I'll show you what that is in a second. So we've added a scribe. This is a daily clinical note. You can see that I did a scribe today at 9:45. It's a 38-second scribe, which may or may not seem like a lot, but you can get a lot in less than a minute. So I've added a scribe, and if you want to come back to it, you can add an additional scribe as well. So you're not limited to just adding one scribe per note. So I can just click the scribe button and scribe again. So that's what it looks like. So I'll just open this note, and I'll just show you from a note perspective of what this looks like. So you have an idea of what we're talking about. So here we're just on a daily clinical note, and this is my template. And that's the other nice thing, is that you can push the content into a template that you create as well in Notero. So it doesn't have to be a specific template that we use. You just have to have the ability to push the content in a text field here. And so I do have this already in the widget that's included in the templates, and so it's a soap note widget. So this is just a typical note. This is my scribes. So as I was saying to you, I can add multiple scribes. So we'll just click on this and take a look at what has. So this is something I just spoke in just common language, and this is what was returned to me. So I got this return, and so there's a little warning, not a warning, but it tells you to review it before you're added to the scribe. So there's two ways I can do it, and so this is the primary complaint was neck pain, and this is the section that we want to add it to, and so I have a drop down here, and I can add it to any of the sections that are in this note that will accept this text content. So I just take a look at this and I say, yeah, this looks like it's for the subjective section. This is also going to the subjective section. Maybe I don't want this, so I can literally come in here and delete this if I wanted to. So I can just delete this if I wanted to, or if I don't want to delete it, there's a drop down here, it says do not add. And so I can just change that as well. So you can make some changes as the scribe gets returned to you before you want to add it. And you just go through whatever type of conversation you're having, and then you can add it to the note or add and finalize. So I can just click add to note, and it'll add it to the note. Okay, so this is what the scribe looks like, and this is just one perspective being the note. So let's go back to the calendar, because this is really the workflow that we're talking about. So we'll go back to that calendar page, and so these 3 appointments I've already seen. So Larry Bird is currently being seen, and so I'll go through what could be a typical workflow, and a very fast workflow. So we'll pretend this is actually at the end of his appointment, so I can create my invoice, and I can wait till he comes out, pays it, or you may even do it ahead of time. And then when it comes to the clinical note itself, I can just add a note, and I'm going to have to pick. So I'm just going to pick my template as my soap note here, and so now I have the ability to describe. And so you still have obviously the, you know, other actions that you would normally have, but we're just going to scribe right now for that clinical note. So I'm going to click on scribe, and there's a few things. So the reason I have a credit balance of 240, and so there's a limit. So if you think that you're going to scribe longer than 15 minutes, and honestly, that's a lot of content. And the longer scribes would be that conversation. So someone may come into your clinic, and it's the very first time, and you want to just capture that subjective information. Maybe they're in a motor vehicle accident. It will do a very accurate job of separating out the two voices, and it will extract the information that the person's telling you, and then you can stop the scribe at that point, and as it gets returned to you, you can just push all that information of that conversation you had, say of a motor vehicle accident or an injury, and you can push that quickly into a note. So as opposed to trying to keep track of everything, especially that subjective, which could be a very large chunk of information, but especially the very first time, you can stop the scribe at that point and then wait for it gets to process, and you can push that into a note. If I feel like I don't have enough credits, I can also add credits directly from this screen. So I'll just show you how this recorder works, and then I'll do a scribe. So for example, I can start scribing. You're going to get a countdown, and then I can start recording. So you can see that it's recording my voice, and I can pause it at any point. I can also restart it if I want, so I can just start it again. I can hit the restart button. And in other words, maybe I made a mistake. So this is the conversation that I'm having right now. If I were to send this off, it's probably going to return nothing because there's really no information that it could understand that is relevant to the model that we're using. So it probably would return a blank scribe. So I'll just say yes, restart, and it's going to restart my scribe, and then I can start all over again. So or I can close it if I'm not ready to scribe. So I'll go back to scribe, and I'll just show you how this works. And so I'll just click on it, and then I'll just show you the workflow. So before I do that, so again, imagine someone's in the room, and you've either checked them out, they paid, or they're still in the room, and there's some sort of transition. You can come here, and if it's only going to take a minute or two, you can start scribing as the person is maybe that transition point, or maybe you're getting the room set up. Maybe there's some sort of cleanup or whatever you did in your treatment, and there's some cleanup. You can actually scribe as well while you're cleaning up. If you have a device and it can record you can pick up your voice and record what you're doing. So again, there's all kinds of possibilities. So imagine the person, say, in their room, and I'm going to hit scribe, and I'm going to hit the record button, and then I just start scribing. So the patient came in and complaining of right shoulder pain. He describes the pain as an excruciating pain when he raises his right arm above his shoulder to reach into the cupboard. He started noticing the pain approximately 2 months ago, and it has continually gotten worse. He also states it wakes him up at night when he rolls onto that shoulder. He's had no other treatment for the shoulder pain. He has had no diagnostic imaging for the shoulder pain. He's been on no pain medication other than Tylenol. He finds that Tylenol helps relieve the pain temporarily. Ice and heat have also provided relief. Physical assessment revealed restricted range of motion, inflection, abduction, and external rotation, and they were all reduced by 50%. Resistant range of motion was graded at 4 to 5 for flexion, extension, and external rotation. Special tests included empty cam test, which was positive. Palpation revealed tenderness of the long head of biceps, and it's a possible impingement syndrome of the right shoulder. Today's treatment consisted of shoulder stretching exercises, shoulder joint mobilizations, ultrasound at the insertion of biceps muscle, and ice was applied at the end of treatment. And so you can see that, I've ended it there. So that was 1 minute and 9 seconds. And there's a lot I put in there. And so again, if you can sort of imagine or conceptualize that, you can get quite a bit of information in there. And yes, it was scripted that I was going off of because I don't actually have a treatment in my head that I did. But if all you're asked to do is repeat what you, and I'll upload this. So all you're asked to do is repeat what you basically did for that treatment. So if you can talk and remember, and it doesn't have to be perfect in terms of dictation. So dictation, if you're dictating, it's a lot different. So dictation would require you to say, I don't know, oh, Mr. Bird came in complaining of right shoulder pain, period. He also described the pain as a burning type of pain, period, new paragraph. So you have to put specific prompts in there for dictation to understand what you're doing. where in this case, you don't have to put specific prompts in there. So it's been sent off. So you can close this as well. And so you can see that it's processing. And then, after you've checked them out, you're basically done, because what we're advocating is that at the end of the day, you just go through and you review all your scribes as they return. So this is from the appointment. And so some people may say, it's kind of tricky because I'd like to see the note. So let's go to Larry Jones. And so we'll do the same thing. We'll add a clinical note, and I'll just pick the same template, and I'm not going to scribe from here. We'll go right to the note. So again, some people may want to see the note, and there's no scribes, and it's the same sort of function here. So again, you would just click scribe, click on this, and then it would be something quick. Larry Jones came in complaining of low back pain. He describes the pain as a burning type of pain radiating down the posterior aspect of his right leg, period. Treatment consisted of ultrasound, TENS, and myofascial release, and a series of stretching exercises. Ice was performed at the end of the treatment. So again, I was talking really fast. Again, this is just a demonstration purpose, but just very briefly, if that's all you did, that's all you need to do. And then again, you just follow the upload. And then, once it shows that it's been processed or uploaded, don't leave the screen while it's uploading. So it's been uploaded and now it's processing. So again, if you wanted to see the note that you were doing, you might want to come to the note directly. So if I go back to the calendar as an example, and if I click through these again, you can see that these have been already processed. This is the one that we're looking at. This is still processing, and oh, that's the one I'm getting confused. Oh, that's what's still processing, and this one is it's still processing. It's almost complete. Okay, so at the end of the day, you're going to come to your dashboard, and then you're going to review all your scribes. So in the drop down here, we have 3, and these are the ones that I had already sent earlier today. And there's a few things that you can do. So I can click on them individually if I wanted to. So that's one way. So if you want to take a look at it individually, I have a drop down here where I might want to just delete the scribe itself or review the note. So I do have some functions in that drop down menu as well. I can, if I was the admin, I would have all my practitioners lined up here, and so I can definitely see that. So refreshing my screen, I can see that first scribe I did is ready to review. So let's take a look at the review all, because this is a much more robust workflow. So again, those are the ones that were looked at. And so you take a look at this, you review it as I was suggesting, where you want to push that information. And it's not perfect. So, and no scribe is going to be perfect, but it's going to be an interpretation and where we think the information should go. And so once you start scribing and push it into, if you're using the same note template, we will just default these sections, like current symptoms and previous medical history. We'll default it to the section, so you don't have to always select them. So in this case, this has always been pushed to the subjective information. And you'll notice here's the previous medical history. This statement here, left trapezius pain, the patient received ultrasound treatment to the left trapezius muscle, which is something I did today. So that's probably something I'd probably want to leave out. And the assessment was neck plane, and this was the plan. And so this is probably what I want to add. So once you get confident and once you get really good at this, you may say, I don't need to see the note, and I'm going to do everything from here, and maybe I just hit add and finalize, or maybe I just want to add it to the note. Once you add it to the note, then you go to the next one. So to a 4, and then I'm on the second, and you just continue the process. So people have used this, people who have been using this for a couple months. One person said normally it would take about 30 minutes to do their notes for about 4 or 5 clients or patients. And that workflow has been reduced to about 5 minutes just with the scribe. How she's using, I'm not sure if this is what the workflow that she's using, but the ability to just add to notes or add and finalize. So that note has been finalized. And so you're basically done. So if you're happy with the review, then you can just push it confidently into the note. So, but we are recommending that you just take a look and make sure the wording, that you're happy with the wording. And so I'll just skip this one here. And this is the one I just did. So the pain in the right shoulder. So this is what it would look like. So, everything describes excruciating pain, unspecified treatment, no diagnostic imaging, MRI. So it's pretty accurate. Previous medical history, right shoulder pain, managing with Tylenol, ice, heat, no previous diagnostic imaging. Again, sometimes it puts the information in additional spots. If you don't want that, then just, this previous medical history, you can just do not add to note. Here's a physical assessment. It did grab an so it's supposed to, take out the ums, but for the most part, 50% resistant range of motion, 4 to 5. Special tests included, again, might have been just my mumbling or how I was talking. So again, you just might have to make sure, do a few corrections, and then here is the plan. Perform shoulder strengthening, applied ice, ultrasound, and ice. And then that's it. And so if you're happy with that, you can just push that into the note. And once it's pushed to the note, it doesn't mean that you lack the ability to edit it at that point, unless you finalize. Then you're going to have to revert it back to draft. But in this sense, you wouldn't have to. And this is the final one that I did for Larry Jones. So let's take a look at that, see what it came up with. Describes as a burn sensation, previous treatment. So it captured, pretty well everything that I said. Low back pain, rating down the right leg, and this is what I performed. So again, very accurate in the information that we send, and the interpretation of that information gets returned. And so again, if you can think of this as in terms of, again, that subjective, if you just want to capture that subjective information of a two-way conversation, very, very accurate. So saves you an absolute ton of time. So you don't have to use this in every instance, but again, imagine the workflow. Someone comes into your office and you're just, you're treating them, you're waiting for them to either get changed or there's some sort of transition between the next client or patient. Quickly do your scribe and then, move on to the next patient. So you don't need a lot of time in between. So it's not like I need now 10 or 15 minutes to create my notes. That can get reduced to like literally 2 minutes. Because within 2 or 3 minutes, you can capture a lot of information within 2 or 3 minutes. So this is just a huge time savings in what you need to do. And so again, you can do it either from the note or you can do it directly from the calendar. Again, if you're using the calendar, the workflow just makes a lot more sense if you're doing it from the calendar. So I'm going to open it up to any questions that you may have. And we do have a question. So I'll read the question. If I have a pre-filled note already, like a duplicated note, and then I use Scribe. Oh, something happened. Sorry. My view changed. I'll read that again. If I have a pre-filled note already, like I duplicate it from a previous note, and then I use Scribe, how is Scribe information integrated? I believe it gets added to the bottom of that text field. Is that correct, Ryan? So if you had the subjective section, you already had content in there. I think we put it at the.
It's appended, yeah. Anything you push from the scribe gets appended to the field. If it's empty, then it's the only thing there. If there's something there, it's added on.
Do I have access to the original recording?
Currently, no, but that is something that we're considering adding if we get enough interest for it. So currently, they're actually deleted automatically, but we may make that optional to allow people to set it so they can retain it.
Any other questions, Ryan? I don't know if you have any. You're seeing any questions?
No, I don't have any on my end.
Okay, if you have, and every clinic. Oh, I should mention as well. Every clinic has been. Every clinic starts off with 300 credits. So if you do want to give it a try, I mean, you do have the ability to try it. If that's something you think you're going to use. So we have loaded every clinic with 300, and every new clinic will also get 300 clinics to try the feature. I'll just wait to see if there's any other questions. Oh, yep, there's how are credits determined? Ryan, if you want to.
How are credits, like, so I think the question is how are they consumed?
Yeah, maybe if Justin, if you want.
In short, like the easiest way to think about it is it works out to 16 cents per recorded minute. Credits work out to credits are basically 1 cent per credit USD. And if you're Canadian and you're charging Canadian dollars, it'll be a bit more because of the conversion. But basically, it works out to about 16 cents per minute for the recording, And we do bill right down to the quarter of a minute. So if you are a 15-second long recording, it'll be 4 cents.
Okay, there's a few more questions coming in. Can I set the categories in Scribe? I see a list in the treatment provided today as planned. I'd prefer to have a section called RX today. Yeah, so where you push that information is based on your template. So if you have a field or you have a section called RX today as an example, you can push it into that information. What you saw on my screen, the drop down in terms of subjective, is that's how the note template was set up. So it's going to be based on the note template which you're pushing that information into. So those drop downs are coming from the note template. So whatever you use in your note template. Can we do multiple scribes? Yes, you can do multiple scribes for one note. So if you want to add additional information through a scribe, you can do that. Are there any plans that include Scribe in it, or it's all based on credits? It's all based on credits, and so all plans, Legacy, Core, Plus, and Max all have the ability to Scribe. Okay. I use subcategories within my objective. How would that work? For instance, I do manual testing. So if you have sections in there, you can push it into the sections, within the note. So however you set your templates up, and as long as there's a text field to push that information, you can push it into that information, or that information get pushed into. I just want to make sure I didn't miss any questions. Could there be a simple dictation option, i.e. no AI? You can do that right now. So a simple dictation, you can, as long as your device or your computer has the ability to dictate, you can do that now. So you just put so for example, if you're using your phone, as long as you have that turned on your phone, you put the cursor into that text field and you can start talking.
Usually it's a microphone icon on the keyboard.
So, and you can do that from any device. And some computers also support that. I don't know if you can get an extension on a browser, probably. Can you create notes while performing a treatment or just after? Can you create notes while performing? Oh, while you're doing the treatment, as long as there's a note already created in draft, you can scribe anytime you want. If that's the question, I'm not sure if that's the question, Ken. It sounds like that's what you're referring to. Don't know if there's any other questions. Doesn't appear to be any other questions.
Nope, not on my end.
Okay. So, wait. Okay, perfectly. Wait. Okay, thank you. Will this be a replay for YouTube? Yes. So we'll be posting this to YouTube shortly after. So once we get the rendering from Zoom, it'll be up within a half hour. So yes, it'll be available.
You'll get an email in a few hours as well with a link.
I think it looks like it's. I just want to make sure. I'll just take one. I don't want to make sure I didn't miss any questions. Okay. What else can AI credits be used for? We are going to be rolling out other features for AI as well, and it's not just the other thing too that we won't do is that we'll try and release features that are appropriate and functional. We're just not going to release features just because you can evaluate this content with AI. So the next features that we will be rolling out, you'll find them extremely helpful, and they will consume some AI credit. So there'll be other features that we'll be rolling out within the next couple months. Okay, it doesn't look like there's any other questions. So thanks for attending, and this will be posted to YouTube. And you, as Ryan said, you will be getting an email in a couple hours, and there'll be a link there if you want to take a look at this video again or share it.
Awesome.
Okay, excellent. Thanks everyone for attending.
All right. See ya.